Go ahead, ma'am.
Good afternoon, everyone. Myself, Dr. Kanchan Turukkar. I am consultant at Oasis Fertility, Pune. Today, Dr. Sayali was going to do this Facebook Live, but because of some emergency, I will be doing this Facebook Live. So, dear friends, today we are going to discuss is about very important topic, that is monitoring in IVF cycles. Now, we know some of it about IVF cycle, that how IVF or test tube baby basically is you know uh, related to monitoring and what are the scans that we do. So we are going to talk in nutshell about what is the monitoring in IVF cycle. Now basically when you have been advised IVF, or for one or the other reason, any reason, you have been advised for going for IVF treatment, so basic evaluation of you is very very necessary. The basic evaluation in the form of basic scan, then some basic investigations in the form of your blood group, your sugar levels, your HIV status, your husband's HIV status, semen analysis, basic semen analysis, then other basic hormone tests like AMH test, then thyroid level, prolactin level. So these are the very, very basic tests that you need to have prior before you start your IVF cycle. So these are very, very basic investigations that we routinely do before going for IVF. Now, first and foremost, you should have a fair idea that how the monitoring is going to happen, like how frequently you will have to visit the doctor, how frequently you are going to have scans, and how frequently the blood tests are going to happen, and when tentatively your ovum pickup is going to happen. So this is the tentative, we should have unfair idea so that we can manage our schedule accordingly. So this Facebook live, I will be giving idea about how frequently we do the scans or blood tests, so that at least if you are planning to have a IVF, or you are planning for this treatment, then some or the other inputs from this live session you may be having. Now, coming to, as I said, that basic evaluation of yours, this basic evaluation need not to be done on second day only, or any particular day as such, or empty stomach. This basic test and basic scan you can do at any day of your period. Okay, more preferably on the in the luteal phase, that is in the day 20 onwards. So basic evaluation can be done in any phase, any not as fasting. Then again, uh, this process, generally IVF process, as a stimulation process, start from second day of your cycle. Most commonly it starts from second day of your cycle. Now, in on second day, there are some scan that happens, that basic antral follicle count we see for, then we see for endometrial thickness, that is it should be shedded. That means your endometrium should be properly shedded. We say that ET should be less than 5 mm. There should be no follicular cyst, because what happens now, if at all you have this cyst, then if we are stimulating you, this follicle may increase in size. So we don't want that. So your ovary should be properly down regulated. That means you should not have any follicular cyst. Then your endometrium should be shedded. That means your ET should be less than 5 mm. This is also called as rule of 5. Then we do also do estrogen level, and some of us also do LH level. So estrogen level should be less than 50, and LH level, that is luteinizing hormone level, should be less than 5. Now this is about the basic requirements that we check on second day, or whenever we start your cycle that day. Then coming to further monitoring. So on further you will be given injections. Those injections will be gonadotropin injections. These are given to increase the follicle size. Okay, and it depends upon your height, weight, your BMI, then your ovarian reserve. Accordingly, your fertility specialist will calculate how much dose is required, or how much dose is best for you, for your follicles to grow up to optimum. So this dose will be calculated. Now these injections will be given to you daily from the day the stimulation has been started up to 12th day, generally approximately 12th day, depends upon your response, your ovary response. You may have, completely properly stimulated ovary on day 10, also on day 12, or you may require some time till 14 day, less likely. But most of the time, this stimulation is or we give this gonadotropin injections for 12 days. Now, how frequently we do the scan after we have started your IVF cycle? So generally, after second day, we do it on day 6. Then we do it alternate day, like on 6th day. After that, we do it on 8th day, 10th day, and then on the day of trigger, that is the final day, when we have optimal follicle growth, means maximum follicle we have proper grown follicles. Then when that day we give you trigger. So generally, these are the 2D scans, but in today's era, we also have 3D scans available. We have sono AVC, we have Dopplers available. So this, you know increase our precision. This increase the precision of a fertility consultant. The sono AVC is the recent advanced data that is available with us, and the sono AVC gives us a precise, size of the dominant, of the available dominant follicles, and also the non-dominant follicles. So sono AVC is one of the recent, available scanning method. Now, on the day of trigger, we see how much are the, number of eggs that are expected. So these are called as the expected number of follicles, or expected number of eggs, we can say, from that follicles. So this expected number of follicles, we tentatively know from the scan that we are done at the time of trigger, and then we give the trigger injection. Trigger injection is basically like IUI, we give it for rupture. So in IUI we give it for rupture, but in IVF we give it for egg maturity. So these eggs are grown, but for final maturity of these eggs we give this trigger injection. So this trigger injection is generally, planned accordingly, and then we plan your pickup 36 hours after this trigger injection. So 36 hours, 36 hours, 35 and a half hours, 35 hours, depending upon the number of eggs, of course. So yes, then on the day of trigger, we generally ask you, on the day of pickup, I'm sorry, on the day of pickup, we ask you to come nail by mouth, and your procedure, this pickup procedure is a half an hour procedure, and it is done generally under short GA, and it is a daycare procedure. So I will not be talking much about this procedure as such in this today's topic, because we are basically discussing upon monitoring. Now, after pickup, generally we don't do any sonographies. We give you post pickup medicines, and generally we don't do any sonographies. But if at all we have found that you have, more response, we call it as hyper response, or we have found some more free fluid, or maybe post pickup you are having some bloating sensation or some pain abdomen or any fever, tachycardia, in that case we may do your, post pickup scanning also. In this post pickup scanning, what we look at is any abdominal fluid, we call it as a ascites. So this is called as a ascites. Then we see for any whether the blood flow to the ovary is proper or not, that is we do as a ovarian Doppler. Then we see for any other third place loss, that is if there is a ascites or anything like that. So this is only done in particular cases, in the particular patients who have excessive pain, or who have bloating sensation, fullness of abdomen, or vomiting, or fever. So these are some, or maybe easy breathlessness. So these are some, symptoms of, hyperstimulation. But in today's era, where we are doing frozen embryo transfers, where we are doing, freeze all policies, there we actually have moved to the OHSS free clinic. So OHSS is also one of them. We are the OHSS free clinic because of all the strategies that we use. Yes, but yes, we should be vigilant for each and every patient, basically the PCOS patient who may land up into OHSS. Now, coming to the embryo transfer and its monitoring. Now, generally, as I talked, that we do frozen embryo transfer cycles, because studies have proven that the frozen embryo transfer has good success rates as compared to fresh embryo transfer. So fresh embryo transfer is what, that the cycle in which the embryo have formed, in that cycle only we transfer, that is called fresh embryo transfer. It was done earlier, but its success rate is around 50%. But as we have switched to frozen embryo transfer, that means the cycle in which the embryos are formed, that cycle those all embryos are freeze, that is called freeze all. Then we transfer the best two embryos, depending upon the single or the double embryo, whatever is decided, we transfer two embryos. That is called blastocyst transfer, or blastocyst transfer, embryo transfer, frozen embryo transfer. Now this embryo transfer is done without anesthesia. Embryo transfer is without anesthesia, but before going for embryo transfer, we do some endometrium monitoring. Now, what is this endometrium monitoring? Endometrium is a inner lining where we are going to transfer your embryos. Now, we want that this endometrial lining should be, at least more than, 7 mm. So, it should be like, we try to make it like more than around 9 mm. So depend upon patient to patient again, but we try to make it maximum like 9 mm, so that the good endometrial thickness has good success rate, as proven with many papers and studies we have seen. So this endometrium is again monitored with transvaginal sonography, TVS we see for the endometrium thickness, we see for the blood flow to this endometrium, and also we see for the spiral artery Dopplers. So each and every step, there is now the role of Doppler. Like I told, in the stimulations also we do sono AVC, we have the role of Doppler, and in endometrial monitoring also we have the role of endometrial thickness, their vascularity, we calculate it by Applebaum criteria, that is whether it is a zone 1, zone 2, zone 3, zone 4. The more is the blood flow to the endometrium where we are going to transfer the embryo, more is the success rate. So whenever it is zone 3 and above, then the success rate is good. That means the blood flow to that endometrium is very good. So this is about the blood flow to the endometrium. And of course, we see for the Dopplers also, spiral artery Doppler we see for, and spiral artery Doppler, if it is less than 0.5, then again it is an indicator that the blood flow to the endometrium is good. So spiral artery Doppler also we see. So also uterine artery RI and PI also seen. So that also is one of the dose indicator. So that is also Doppler indices we can see, where we can stratify the dose of progesterone according to the uterine artery RI and PI. So this is the various steps where we look for the Doppler and also endometrial thickness. Now when we have reached proper endometrium, we go for progesterone start we start the progesterone. And then after starting the progesterone, depending upon the day of the embryo that we are going to transfer, like day 3 or day 5 embryo, we are going to give you the progesterone in the form of injections or maybe vaginal gels or tablets. So these are the progesterone preparation that we give. And then after that we go for embryo transfer. Now after embryo transfer, we don't have any monitoring, directly your beta hCG, and then after that your sonography for seeing the implantation or whether your pregnancy, confirmation of your pregnancy, that we call as a confirmation scan. So that we do. So this is about the monitoring in the IVF cycle. So basically we have 2 months of monitoring. In first month we do the monitoring for growth of your follicles, growth of your eggs, and in second month we do the monitoring for your endometrium, that is endometrium thickness, how it is growing, whether it has reached to optimal level, and whether the blood flow to that endometrium has reached to maximum level. So this is about the monitoring in IVF cycle. So it is not very cumbersome. You have to properly have the you will have to have a word with your fertility consultant, so that you can even have limited visits, so that we can plan according to your work also. So it is not that very rigid that yes, you have to come on this day. We are flexible, and your visit also can be curtailed according to the response and according to your dosages. So of course it is very flexible and patient friendly monitoring. And yes, if at all you are going for IVF, yes, you can, without hesitation go for it. With your, if you are working, you can go with your working time, you can adjust it accordingly, and you can of course go for it. Yes, so I think that's all from my side about monitoring in IVF cycles. If at all any questions are there from the viewers, I will be happy to take them. If no questions are there, I think we can close this session. If at all any queries are there, or you do you want a physical, if at all any queries are there, our helpline number are flashing on the screen. Or if at all you want physical consultation, we are available in Pune at Oasis Fertility Vakad and Kharadi branch. I think that's all. There is no viewers question. I'm going to leave this visual. Thank you all for your patience listening.